America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Our producer today, Mr. Sean Floyd. I'm your host, Carrie Hall. This is your show, America. Thank you for joining us and making us one of the most listened to talk shows throughout the United States. By the way, we are on all of your favorite podcast platforms now, so they're all out there. I don't care what it is, we're on it. There's about 15 of them now that we're on. In addition to that, we're on YouTube. We're getting a lot of people downloading these shows. We had 58,000 people download the podcast in the last 6 months. So we're pretty excited about that. This continues to grow. All of you listening on the radio, all of you that go up to the podcast platform, all of you that are on YouTube, the YouTube hours are up to something like 250,000 views, all of you out there looking at these shows and downloading. So we're glad that you like them. Obviously, we hope the content is engaging, and that's why we do this. So if you are looking for help with Medicare, if you are chronologically challenged, I happen to have 3 people in studio today, the lovely ladies from RPS Benefits by Design. And we're going to talk about Medicare, but I'm going to give you the phone number and the information. In studio today with me is Joyce Thompson, Maria Allers, and Carol Lee Steele, the team from RPS Benefits by Design. Anywhere in the country, they can help you. The phone number is 877-385-2224, 877-385-2224. The website, rpsbenefitsbydesigninc.com. RPS at benefitsbydesigninc.com is the website. If you want to send them an email, if you need help, I don't care where you are, they're more than happy to do it. They have offices across the country, and they're happy to help you. So now that I did that, let's just go to the show. Hi, Carol Lee.
Hello. How are you, Carrie?
I'm good. Glad to have you back. Hello,
Thank you.
Maria.
Hi, Carrie.
Welcome back in studio. Hello, Joyce.
Hi, Carrie.
How's the lovely Joyce Thompson?
The lovely
Okay,
Joyce
good.
is fine.
All right, so the purpose of this show today is to basically dive into Medicare and try to give you help, educate you on. It's a confusing issue for a lot of people. You know, I had somebody call me and say, I went up and I tried to look at this thing on the government website and I can't make heads or tails out of it. Well, you've got an alphabet soup. You've got Medicare A, Medicare B, Medicare C, Medicare D, Medicare F, Medicare G. What does all that mean? How does it apply to you? Some of it does, some of it doesn't. That's why we're doing this show. We're going to help you understand that. We're going to tell you what resources these folks have that can help you. That's what we're going to do. So let's just start with the definition of Medicare Part A, Carol.
Part A is hospitalization. And first of all, Medicare is a federally sponsored plan providing coverage for people who are eligible, and there's a certain type of eligibility. Do you want me to go over those?
Yeah, please.
Okay, individuals turning 65 who have participated in Social Security or Railroad Retirement Board benefit, they are eligible for Medicare. Individuals under 65 who have had been awarded Social Security disability and they've had it 24 months. On the 25th month, they are eligible for Medicare.
Now, that's one a lot of people probably don't know. If you're on disability, now you have to wait till the 25th month. So I don't know what you're supposed to do for the first 24 when you don't have medical coverage. But in the 25th month, they then roll over to become eligible?
They eligible for Medicare,
Okay.
Correct. And of course, in the situation, if you have ALS or end-stage renal disease, you can immediately get Medicare as well.
Okay, so that's Medicare Part A, which is hospitalization. Joyce, let's talk about Medicare Part B.
Medicare Part B is the next step to original Medicare. A and B equals your original Medicare. Mm-hmm. The B is for copays to see the doctor. Different things that you wouldn't get from A would be on the B. It's awarded through the Social Security office and / Medicare.
Okay, so let's just stop with B then. But in order to get B, Carol Lee, they have to go sign up.
Correct.
Okay. Well, now I think a lot of people get confused about that. They get intimidated by it. Now I did it. And like I said, if I could do it, a chimpanzee could probably do it. So that's, my skill levels on the computer are about there. But
unless you already get Social Security, and then they automatically send you your Part A and Part B. You can defer it if you want, but they automatically send you when you are enrolled in Social Security, when you already have Social Security.
Okay, but if you don't take Social Security until you're 70, whatever the case may be. So let's go through the enrollment process and what the time frame is. When can I enroll in Part B? There's three 3 times. Let's talk about that.
To enroll in Medicare, you have an initial enrollment period.
Correct.
You've got the 3 months prior to your 65th birthday month,
Correct.
the month of, and then you have the 3 months after.
Okay.
That is the time that you can apply for your Part A and Part B.
So that is what's important to understand. It's 3 months before, the month of, and 3 months after. People get really confused about that. What happens if you miss that window and you don't do it at all?
Then you actually start to incur penalties. The government does want you to get B, unless there are other circumstances, if you have employer coverage, et cetera. But if you just decided not to get Medicare, you would start to incur some penalties.
And you mentioned something there. We're going to, hopefully this won't confuse you. But if you're, I saw an article in the Wall Street Journal today, 658,000 people are now working in their 80s, which is really quite remarkable. A lot of people thought that was pretty funny when I sent that out. Some of the people in this room, actually, because I'm 74 now, okay? And the question was, yes, I will be working when I'm 80. But the point is, if you are working, let's say you're working in your 80 and maybe you're working at Home Depot or maybe you're working, wherever, and you got health care benefits. Should you sign up for Part B?
It completely depends, and that's why you really have to rely on us to inform you. There's so many moving parts, Carrie, to this. If you have an employer plan and you only have 20 employees on there, it's a different scenario than 20 plus. And so it really kind of depends. That's where we come into play. We'll be able to assist you on whether or not it's wise for you to stay on your company plan or to go straight to Medicare.
Okay, and see, this is the thing that you need to understand. You see those commercials on television, and you've got the celebrity spokesman up there. One day he's selling gold, and the next day, he's selling supplements or something, and now he's telling you all about Medicare. And then you call that number, and you get some high pressure salesperson on there that their sole interest is to get you signed up for something and close that sale when we're on the phone. This is completely different. When people call you guys. You sit. I know Joyce, and I know you sit on those phones sometimes for an hour with people, going through their options, explaining to them, and then they get to go back and digest all that and say, "Yeah, I'm going to stay on my employer plan because maybe I've got a prescription drug that under Part D I'm going to have to pay more for. Whatever the case may be, I'm going to go in the donut hole." We'll talk about Part D here a little later. But the point is, you all explain that to them. That's the difference.
And it's not a one-size-fits-all. That's the biggest thing, is everybody, like, my uncle said to do this, this, and this, and it's not necessarily true.
Or my next-door neighbor told me to do this. Yeah, that's the other one you get. Yeah, I heard this when I went to the Kiwanis meeting. Well, no, that's probably not the way you want to do it. So the idea then, Carol Lee, is to give them information so they can make a good decision.
Absolutely.
Yeah. The other thing that happens, Maria, is, again, a lot of people do this. They call that 1-800 number, they get signed up for something, and then these people disappear. Now you got a claims issue or a doctor issue, or Dave and I were talking before on the air today about a bill he got, okay, that he probably shouldn't pay. It was for an anesthesiologist bill. It's probably an out-of-network anesthesiologist that was brought in to do anesthesiology. That bill, he should not pay that. Well, they're sending in the bill and tell him to pay it. If that happens to one of our clients, what happens, Maria?
Well, we actually will reach out and advocate on your behalf. We'll look at the bill, we'll look at your plan, and make sure to determine if you should pay that bill or not. And then we'll contact the carrier and advocate on your behalf to get that bill corrected.
Yeah. So we're not telling you to call the 1-800 I don't give a damn number, because that's what I call it, okay, with a lot of these carriers, where you go through 15 voice prompts and you're trying to get somebody to explain to you, why did I get this bill that I'm covered? Here's my plan. It says it's paid for, but it's not. Well, probably the reason was because that particular physician didn't bother to submit that for an EOB, and they just turned around and sent it to you for you to pay. EOB with explanation of benefits. If you didn't get an EOB with it, that means they didn't submit it to the carrier for payment. They just signaled it out and sent it to you. You're not going to know that. These three ladies know that, okay? And you heard Maria say it. They're your advocate. They call the carrier. We have a little different process than you calling as a pedestrian and trying to get through to somebody to help them. Talk about that a little bit.
Well, and Carrie, sometimes they code the service incorrectly.
Correct. I'm working on one
that
right
happened.
now. Same thing.
That happened to my wife 2 weeks ago on a lab. They coded it incorrectly at KU.
Yep.
Yeah.
And so then we have the experience and the expertise to look at it and go, okay, what did you get done? And this should be covered under your plan. But again, we'll reach out to the carrier, the providers, and help get that corrected.
Get it straightened out. And that's really a key part of this. We come back to the break. We'll now talk about, what is Medicare Part D? Joyce started down that path, so we'll go back to that, and then we'll go through some of these other components. Stay tuned. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. We got more. Stay right there.
The Golden Rule. Treat others as you want to be treated. I'm Steve Keeker, and this is one of the founding principles of my firm, Senior Care Consulting. Since 2002, our value statement has included honor our mother and father, respect our elders, care for those in need, and treat your family as our own. We've been honored to help hundreds of families make one of the most difficult decisions they could ever make, serving them in their greatest time of need. If you're looking for someone who can provide you experienced and objective guidance when searching for a senior care community, reach out today and discover the services of Senior Care Consulting at 913-945-2800, 913-945-2800. Know your options and choose with care at seniorcareconsulting.com.
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. If you've got a question, comment, whatever the case may be, send me an email. Also, if you want to go up, maybe you want to tell somebody, hey, you really need to listen to this show because they're explaining all this Medicare information, and maybe you're getting ready to retire, or maybe you've got maybe your spouse is going to be 65, you're not, vice versa. This is an opportunity to learn how to approach this and some of the ins and outs of how Medicare works. So that's what we're doing here today. My producer is Mr. Sean Floyd. I'm your host, Carrie Hall. In studio with me, the lovely Carrie Lee Steele, Maria Allers, and Joyce Thompson, all from RPS Benefits by Design. If you want to reach out to them, it's 877-385-2224. That is the phone number. The website, RPS Benefits by Design, Inc., that's INC.com. And they'll be happy to help you if you send them an email. Just tell them when you go on to contact them, what is it you're interested in? Medicare, ACA, whatever it is, they're happy to help you with that. All right, Joyce, let's now go to this Part D prescription drug and talk about how Part D, first of all, when do you sign up for it, and do you sign up for it separately? How does all that work?
Okay, Part D, there's several different periods that you can sign up for Part D, just like with the Medicare Advantage plan. One of the special enrollment times would be AEP. It comes around every year from October 15th through December 7th, and that's when you can apply for a Medicare Advantage plan or the Part D. The Part D is for prescriptions. So each company has their own plan for Part D. There's several companies, but Plan D does the same thing everywhere.
So like United Healthcare, Blue Cross, Aetna, Humana, they all have a D, but they're all the same because they're regulated by the government.
Exactly, and they have to work the same way. The only thing different could be deductibles, out-of-pocket max, and premiums. That's why it's best to see a broker when you get ready to do this, because you can make a mistake and then you're stuck with that plan. So we do advise you to call us. We make an appointment, you come in, and then we're going to put it all in front of you to help you understand.
In the Medicare Advantage plan, the Part D is included inside the plan.
And that's one of the benefits to a Medicare Advantage plan. That D is in the plan. And Part D, like I say, you can get that from Aetna, UHC, different places. Well, that goes with the supplement.
Okay, so if you're on a med sup like I am, you have to buy a standalone Part D. So I have a Blue Cross and Blue Shield Medicare supplement, but I have an Aetna Part D prescription drug because the formulary works better for us, and we'll talk about that here in a minute. The formulary works better for us on Aetna. So, Carol Lee, talk a little bit about the formulary. And Joyce said, we want you to come in and sit down. You asked them to bring in their prescription drug list, right? Or, if you're in Phoenix, if you're in New Mexico, if you're in Nashville, Tennessee, you can do all this by Zoom. You can do it all on the phone. Just you need to have your list ready so they can look at the formulary and do what?
Well, usually all formularies have like tiers. So different tier 1 and 2 are typically the generic or the preferred generics. And then you get into brand names and then specialty drugs. Okay. So everyone is different. Like a husband and wife. The wife may take 2 generic drugs. Her husband may take, he may be insulin dependent. And it really depends. So we will figure out what is the best separate Part D drug plan according to the medications that they take. So we usually ask for the name of the medication, the dosage, and then the frequency, because that actually comes into the end of the equation as well.
So if they're considering doing a Blue Cross plan versus United Healthcare plan, it's a Medicare Advantage plan, that could factor into which one of those 2 they chose.
Absolutely, because
Okay.
not every carrier has them in the same tier. Across the board, there may be somebody may have a drug at tier 2 and the other one will have it at tier 3, and there's a higher cost to that tier 3. So that's what is a consideration.
So what is the donut hole? I mean, it's not a place where we go to Dunkin' Donuts and get the little donut holes they put in the bag. I get those on Saturday mornings for my men's group. But so talk about the donut hole.
Donut hole. Yes, that is also called the coverage gap. So there is a initial enrollment. So it's whatever medications you take, it's the carrier, it's the retail cost. So it's whatever the carrier pays and you pay up to there's a 4,800?
4,800.
4,860. Anyway, when it gets to that, that's when you hit the coverage gap or the donut hole. And you have to pay for 25%. The copay's changed. It's 25% of all drugs. Except for insulin, there are new programs in there where they kind of cap at a $35 copay for a lot of those dependent insulin injections. And then when you get to $7,400, it goes to a catastrophic phase.
Okay, do you see why this is confusing? Are you listening to this? Okay. If you think you can do this on your own, good luck. And if you want to go up on the government website and try to sort it out, you better have some Tylenol next to you because you're going to get a headache by the time it's done. That's what these folks do. They're experts at this, okay? They can take your formula and go through and say, you know what? Yeah, the United plan, maybe that looks a little better over here on this side than the Blue Cross plan. But when I'm looking at the Blue Cross formulary, your drug is tier 2 here. Over here on United, you're tier 3, or your out of pocket's going to be X. Okay, so those are the things you don't know. Okay, and those are the things they do know. All right, so that makes a huge difference, is being able to explain to people and dive into the details here and get them what they need in a way that's going to make sense for
And
them.
to piggyback on Joyce's, as far as Part D, the October 15th and December 7th, that's when you can change your Part D.
Right.
Because the carrier might come out with your plan had a tier 2 and it bumped it up to a tier 3. So what we can do is we can look at all of the other carriers and all of their Part D drug plans and see if some other plan fits.
So you're on a Medicare supplement like I am. That's your chance to move your D if you want to move the Part D to a different carrier. Or you heard what they said. It's always wise to have them look at it at the end of the year and say, hey, you know what? They've changed the formulary and this drug's going to cost less or it's going to cost more, and you need to know that. So the idea being that you need to have somebody evaluate this and tell you if it's the right thing to do, stay put. Okay, or if it's the wrong thing to do, it's time to get off of it. If you're on a Med Sup, that's definitely going to be the case that you want to take a look at that. If you're on Medicare Advantage plan, you want to evaluate the whole Medicare Advantage plan,
whole
right?
thing,
Yeah,
yeah.
and it's because these things change.
Every year.
Okay, and this year we're going to have change because there's a 1% cut coming out of CMS. It was going to be 3%, but I think a lot of people with hair the color of mine raised a lot of hell when they heard that. And all of a sudden now the Biden administration has decided we're not going to do a 3% cut in 1 year. We're going to do 1% over 3 years. So we don't think the impact of that's going to be great, but there is going to be an impact.
Yes. And we just have to, October 1st is when the plan information comes out. So we take a look at that across the board, how they, are they heavy medical utilizers of the services? Are they? And so we look specifically for them as an individual of what's best for them.
Okay, and you're going to see changes this year. That's why we're doing this. Part of the reason we're doing this right now, here's July, all right, and we're talking about what's going to happen in October. Well, they're going to know the plan designs by probably September. Okay, they'll have drafts of the plan designs from the carriers. Is that about right, Marie?
right. That's right, yep.
So they'll actually know what's going to be there. you need to take the time to take your plan and have them take a look at it and see if it makes sense to stay or it makes sense to move. And that's what they're going to do if you give them a call, 877-385-2224, or the website, rpsbenefitsbydesigninc.com. Stay tuned. When we come back from the break, we're going to get into some areas we haven't talked about yet for folks that have special needs. Stay tuned. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting on the HIA Radio Network, coast to coast across the USA. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You know, if you are a provider out there, if you're an MD, if you're a chiropractor, if you're a physical therapist, if you're a neurologist, whatever the case may be, you probably ought to take a look at a website called Neurologic.life. So what you're going to see when you go up there is a program called the Wavi Brain Scan, which was invented by a 4-time Nobel laureate contributor, Dr. David Oakley, and David Joffe, who invented that little thing they put on your finger when you go to the ER, the urgent care. That's who these people are. So here's what the Wavi Brain Scan can do. This is just some of it. Concussion protocol. If you've got a child that's had a concussion and you're going to put him back out to play, how do they know he's ready to go? Oh, he fills out a piece of paper called the concussion protocol. Well, that's going to determine whether he can go play. If he had a Wavi Brain Scan, you'd have a picture of his brain that would tell you he or she is ready to go play or they're not ready to go play. That's one of the things it can do. It can also help that people that are pre-Alzheimer's or dementia. This is another thing it can do, early detection, PTSD, anxiety, and sleep. The website, Neurologic.life. CPT codes covered 100%. You can submit it through the health insurance plans or cash pay, whichever way you want to do it if you're a provider. Once again, the website, Neurologic.life. All right, so let's switch gears now and talk a little bit about special needs. All right, this is a very unique category. We just started working on this year. There's 3 categories for special needs. Let's see if I get this right, Carolee. Chronic conditions.
Correct.
So heart failure, type 1 diabetes can qualify. Those are the kinds of things that'll qualify. On Medicaid. So if you're on Medicaid, you get Medicare, but you can get a special needs program. We're going to talk about why would you do that? You'll see in a minute. And then if you're in a nursing home. So now maybe it's your mom. She's 90 years old. She's in a nursing home or an assisted living facility. This plan can make a big difference. So let's talk about special needs and how United Healthcare's got a great program. Aetna's got some programs. Let's talk a little bit about that. Carolee.
And I think it's so important to know because a lot of people, especially the dual special needs, that's the one you talked about with Medicare and Medicaid, a lot of people have both. And they said, well, that's fine because they cover whatever Medicare doesn't. Medicaid covers it. But they're leaving a lot of benefits on the table. We're talking a heavy amount of dental and vision, hearing services, transportation, over-the-counter products. And it's a substantial amount for those who are dual eligible.
So on a regular Medicare Advantage plan, Carolee, there's copays for everything, correct?
Correct.
Okay, so across the board, you've got copays. You've even got copays for primary care, right, Joyce?
That's correct.
All across the board. The only thing you don't have copays on typically is when you go in to get your colonoscopy or those kind of things. But otherwise, you've got copays. Let me tell you about the copays. So I'm looking at the United Healthcare plan. Here are the copays. The column of copays on here for everything from monthly premium, okay, 0, okay, primary care 0, specialist 0, inpatient hospital 0, outpatient 0, home health care 0, lab, emergency urgent care, all 0. Brand or generic drugs, 0 copay. Okay, yeah, it gets better. Mail order, yeah, again, you're 0 copay. And now, Carolee just mentioned some of the things that are available. $230 a month to buy healthy food. $230 a month to buy healthy food. You can't go to McDonald's, but I think you get the message, okay? Dental benefits, $4,000 of dental benefits.
That's huge.
That's bigger than what you get on a typical health insurance plan, okay? 0 copay for routine transportation. So if you're that person who's partially immobilized or whatever the case may be, maybe you just don't want to have to deal with driving to the doctor or the hospital. They'll provide transportation.
And some people on Medicaid don't have cars, and that helps them.
And that's in the routine hearing, $3,500. If you need a hearing aid, $3,500. And then obviously you have an opportunity to go to the gym. These benefits are so rich.
Very rich.
So it really would behoove people if you're talking. Maybe this is your mom, your grandmother, your uncle, your aunt, whatever the case may be. It's either got a chronic condition or maybe in a facility. And a lot of folks in rural communities, the heaviest use of Medicaid, Maria, is in the rural communities.
That's right. They don't have as much access to the. I'm sorry. They just don't have enough access to the plans and the network as they should, and Medicare really does help.
Yeah, and in rural communities, a lot of people are at the poverty level or below because the opportunities for employment are not the same, especially, and who stays in these rural communities? Typically, it's the older people because the younger people are leaving. So now what happens? It spirals down. You just heard Maria say it. They don't have the kind of care they need. Okay, so let's say you're up in Cameron, or you're in Bethany, Missouri, okay, or you're in Tupelo, Mississippi, whatever the case may be. But the doctor and the specialist you need to go to is an hour away. Are you going to get a car and drive an hour if you're 85 years old, 90 years old, and you've got a condition? Oh, you don't have to, because they'll come and get you. They'll put you in a specialty van and take you, right, Carol?
Correct. Transportation is zero.
And they'll pick you up and bring you back. So I guess what I'm trying to get across here is if you're a caregiver, okay, if that's your mom or your dad, maybe you're in another state and this is going on. You need to reach out to these people and they're specialists. This is what they do. Okay, have a conversation with them about, does my mom qualify for this? And I'll tell you another thing. For example, heart conditions like the one my wife has don't qualify in Kansas. Right. But they qualify in Missouri.
Mm-hmm.
Yeah, you're not going to know that. They do, okay? So, that's important to understand. So they're going to know where there are differences in these plans and what kind of coverage you can get as a result of those differences. So it's if they just call you and have a conversation, Carol.
And that way we can go through their individual scenario. What do they have? But there's so many people. The biggest thing I want to is the dual special needs. That's the one where they don't think that they need anything else, because basically Medicare and Medicaid pay for everything, but they're leaving so many benefits on the table, which they absolutely need. That dental, that vision, the healthy grocery, the over-the-counter products, which is your Tylenol, floss, NyQuil, compression socks, all those things that are really seniors need, that is available to them at no cost.
And think about that. If you're, if and there are a lot of people out there, not in the urban communities and the rural communities, who are living on Social Security, or maybe Social Security and a little bit of something else they had, maybe a retirement plan that they had at work, or whatever the case may be, but they're just barely getting by. If they got $230 a month to go spend at the grocery store, you think that'd make a difference, Carol Lee?
That and utilities, absolutely.
Make a hell of a difference, wouldn't it? Okay. But you're not going to know about that if you don't get on the phone and give these people a call. 877-385-2224. 877-385-2224. The website, RPS Benefits by Design, Inc. And by the way, Jimmy Walker's not going to be the guy you want to call from Good Times to ask about this, because he doesn't even know it exists. Right? So I just want to make that point, okay? You see these ads out there trolling for this kind of stuff, and you're not going to get this kind of service. You heard Maria talk about this. Is another thing. This stuff is complicated.
It is.
So, you're right up with a provider issue, or maybe you're up in Cameron, or maybe you're in Southwest Arkansas and you've got to see a specialist. Who's going to help you find that specialist? You going to call up Jimmy Walker and ask him to help you out, or Joe Namath? Probably not. Or maybe William Devane. Okay, I don't know, but probably not. You know what I mean? So this is a full support system. That's what these people do. They're there every day to help you if you have a question or a problem, and they do it.
Mm-hmm. And this is actually the time of the year that we go through an extensive amount of training and education to be able to pass the AHIP.
Okay, so that's interesting. So Joyce, talk a little bit about that.
So
how much fun? I remember when I was.
How much fun is it?
So much fun when we used to do this. Talk about this.
Once a year, we have to recertify with CMS Medicare, also with every carrier. Mm-hmm. Then once we have done that, then we can go see the rollout and see the plans, figure out which plan are we going to be showing most. And then we spend 40 hours, at least 40 hours of training, testing. And then we have to pass the CMS test with a 90%.
Do you hear that? This ain't high school. Okay, you got to pass with a 90%, and if you don't, you're not licensed
You're not
to sell this
licensed.
product. So, is that a good thing? I think it is, because it gets rid of people who really don't know what they're doing or really don't have any business doing this. You get rid of a lot of people that really shouldn't be doing this. But I remember we used to do this when I had Benefits by Design before we merged the two companies. And I'm going to tell you something. It was a process. Everybody in our office did this, and it was very, very difficult. Well, the point is they go through this training every year, so they know the latest changes, what's happening with the carriers, what's happening at CMS, and you have to go back and you have to get certified by each carrier, because each carrier, Carol Lee, has a different set of products.
Correct.
That work differently, right?
And you have to be certified with every carrier. Mm-hmm,
Right.
You do.
So it's
a
just
lot.
not one and done. If you're going to do Humana, United, Blue Cross, Cigna, you've got to get certified with 4 of them. Plus, as Troy said, you better get 90% or you're not going to pass the test. So that's why they're experts. Okay, they spend a lot of time doing this. They know what they're doing, and they know how to do it and do it well. Stay tuned. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. My producer, Mr. Sean Floyd. And by the way, behind the camera is Dave Thiessen, who's always behind these cameras. So all these shows that you see up on the video platforms, that's all done by Dave. He handles all of it. He posts them all, and he transcribes them all, so that when you're out there looking for something, you can find it. It'll be on one of our podcasts. It'll be on our YouTube, whatever the case may be. So we're here in studio today with Carol Lee Steele, Maria Allers, and Joyce Thompson from RPS Benefits by Design. We are talking about everything Medicare up to this point. And again, the whole idea behind this is to educate and inform. And I'm going to reiterate it again. When you call these people, they're there to help you. They're not there for a high-pressure sales. There are people that call them. They don't sell them anything. They tell them, hey, you know what? You got a great plan. Everything looks good. Leave it alone. All right. And on the other hand, if you've got something that's not working the way it should, or there's a better opportunity for that Part D prescription drug that's going to save you money, they're going to tell you that. Okay. Or if they're going to tell you, you know what, that particular doctor or hospital that you need is probably not in that network. Let's look at something that is. Those are the kinds of things you aren't going to get by getting a hold of one of these people on the television, okay, or wherever you're seeing these ads pop up on YouTube or whatever the case may be. This is a whole different ballgame right here. Anywhere in the country, doesn't matter. 877-385-2224, RPS Benefits by Design, Inc.com. All right, so we've got this little situation where a lot of people are going to lose $15 million, to be exact, are going to lose their Medicaid coverage starting now, okay? And about 5 million of those people are going to be eligible to do ACA with basically a full subsidy.
That's right.
So talk a little bit about that, Maria.
Yeah. If so, when they do lose their Medicaid, they qualify for an ACA plan, where they can meet with us to discuss. Again, we go over their prescription, their medical history to make sure that we counsel them on the right plans to pick out. And then we also help them get subsidy for the plan. And oftentimes, the subsidy is so great that you're paying zero for the premium for the plan. So it's just a great program that people just forget about.
Well, I don't think a lot of people know about it, Maria.
Yeah.
I mean, the problem is, these people are going to be getting these letters. They're getting these letters saying you're losing your plan, and they panic because they have nothing.
That's
okay?
right. They don't know what to do. They say, now what?
Yeah.
And that's what we're here for. Is we're here to help them with that gap.
And here's the other thing it's important to understand. You're on a Medicaid plan now, right? Well, the networks and the doctors and hospitals that take Medicaid are pretty narrow, right, Carol Lee?
Narrow, yes.
Yeah. But if you go on one of these ACA plans, you got a full-blown PPO plan. Okay? So you actually have a chance, Carol Lee, to improve your benefits by moving to one of these over a Medicaid plan. Yes?
Correct. And it kind of really depends on their their gross income. We kind of calculate that to what the subsidy is, and then the subsidy can take care of quite a bit of the premium, and sometimes lower deductibles and copays as well.
Okay, so explain that.
It depends on, that's income driven and household driven. So like if you're a household of 3, it's going to depend on income. If you're below a certain threshold, then you would get a premium tax credit, which is monies that the government would give to the carrier on their behalf for part of the premium. So it may be originally $900, it may go down to $2 or lower. And then if you are in the lower part of that threshold, you would also get a cost sharing reduction, which reduces the deductible, co-pays, and the out-of-pocket, which is huge.
Does this sound kind of like Medicare? Sound confusing? That's because it is. All right. And here you're hearing these people, they unwind this stuff. They can explain this to you. You know, you're living in a rural community, you're on Medicaid, which is where the largest number of one of the areas where we have the largest concentration of people on Medicare. We talked about this in the last segment, the folks on Medicare. This is a way you may very well, like I said, there's 5 million of you out there across the country that will qualify for one of these ACA plans with a very low premium or no premium, okay? And that's important to understand. Do me yourself a favor, okay? Don't call the 1-800-BIBLE number, okay? I know you hear these commercials, okay? But I'm just going to, I want to make this clear to you. There are a lot of people on those plans. So that's called Christian Medishare. And I'm not going to knock the plan, but what I'm going to tell you is it's not health insurance. And when you go on their website or you look at the paperwork, it says clearly this is not health insurance, okay? Because it's not. And why is that important? Because it's not regulated by the state insurance commission or the federal government in that respect. So if you have a claims issue, there's no appeal to the Department of Insurance or the carrier. You're dealing with these people that run this particular program. So I'm not a fan of this. I know a lot of people sign up for it. It works for a lot of people. And I also know a lot of stories about a lot of people who it hasn't worked for. Okay. So what I'm saying is if you're in that situation, you're on Medicaid and you're hearing that commercial, you think, well, I'll go call them. You go ahead and do that. But I would strongly suggest that you give these folks a call and see if you qualify for a fully subsidized or 90% subsidy ACA plan that's going to make a big difference, right?
Absolutely. And then also the loss of Medicaid is an immediate special enrollment, so you can enroll outside of the open enrollment in the fall.
See, I didn't even know that. So now you have a special enrollment period where you can enroll, Maria.
Well, and Carrie, what about the population that is wanting to retire early but doesn't qualify for Medicare? What do? They qualify for the ACA plan as well. And they can meet with us to go over to help them until they get onto Medicare.
Okay, that's important because there's a gap there. So you're 63, maybe your husband's 65 and he's retiring, but you're the spouse, you're the wife, and you're 63. What are you going to do for 2 years? He's losing the employer-sponsored health care. Now what are you going to do? What you're saying is, A, they can qualify for one of those plans and get on one of those plans, or there are short-term plans they can do as well, right?
That's right. That's right.
Yeah, so talk a little bit about those. Joyce, about those short-term
The short-term policies, there's 2 companies here that have them. One is Blue Cross of Kansas City, and the other one is United Healthcare, and then there may be some others out there. But they're good plans to fill in the gap between Medicare and 63 or 62. I have several clients that they do that. They're healthy, and they can get the short-term policy. The premiums are low. The benefits are pretty good, especially Blue Cross. You can use the Blue Card and go anywhere in the country with it. So they're pretty good plans.
And they are PPO plans, okay? Yes. So that's important to know. Now, you heard Joyce say her people are healthy. They are medically underwritten. So if you've got... if you've got a heart condition or cancer, you're not going to qualify. That's when you have to go to an ACA plan, right?
That's right.
Yeah.
That's right.
So, but again, you're not going to know this stuff. You probably don't even know that there is a short-term plan out there that may cost you $200 or $300 a month. It can make all the difference in the world. You'd have full-blown coverage. That's important. Thank you all for doing this. Great show today.
Thank
a lot
you,
of
Carrie.
information. Yeah, it was like drinking from a fire hose if you're listening, but that's how you learn.
It's easier
to the
just to
ladies here
call
at
us.
RPS Benefits by Design. Give them a call if you need help. 877-385-2224 anywhere in the country. And now I leave you with this thought from Dr. Martin Luther King. Americans must learn to live together as brothers and sisters, or we will surely perish together as fools. Truer words are never spoken, especially today. Thank you for listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Goodbye, America.